about the remaining drug picture of Belladonna, and with drug picture we will also discuss about the clinical aspects and what are the general modalities, that is aggravation and amelioration. So let's start. So as you can see here, we have generative organs. So first of all we will discuss about generative organs symptoms of patient of Belladonna. So first of all we will discuss about the male symptoms, then we will discuss about the female system symptoms. So first we have male symptoms. There will be acute inflammation of the testicles with much induration and all desires are lost. There will be gonorrhea with much inflammation and cordy. So this was all about the male symptom. Now we will discuss about the female symptoms of patient of Belladonna. So there is pressure downward as if all the contents of the abdomen would protrude through the vulva, especially in dysmenorrhea. There is great pressing on the genital organs as if everything would protrude. Worse early in the morning. Os uteri is rigid, hot and dry with cerebral excitement. There is spasmodic contraction of the uterus. Secretions are arrested and there is dysmenorrhea. There is acute meteoritis with many brain symptoms like delirium, delusion, etc. There will be stitching, sharp pain in the ovary that comes suddenly and goes suddenly, and right ovaries are enlarged. There will be protrude, flooding, red blood, bright red blood, the feeling as if the uterus would come through the vagina. Menses are too early and blood is bright red in color. There is offensive metorrhagia. Vagina is hot and dry, especially in labor stage. For mastitis, mammæ, indurated and very painful. Use it locally as well as internally. Breasts feel heavy as very hard and redness runs in radii. For all acute diseases of the mammæ, it is the most useful drug internally. So this was all about the symptoms of generative organs of patient of Belladonna. Now next we will discuss about the respiratory symptoms of patient of Belladonna. So in respiratory symptoms mainly common cold with hard, dry, teasing, spasmodic cough which is worse at night, and no remedy in the materia medica can equal to atropia. This is the best remedy for treating common cold problems. The constant sensation of wanting to cough, where the spasmodic element predominates in its great indication. A dry, hacking, spasmodic cough, as if something had fallen into the bronchi, or dust has lodged in the larynx. With tightness in the chest and upper air tubes, greatly aggravated evening and when lying down. These are the situations from which the person feel aggravation. And next, takes cold from every draught of air. As we have already discussed in part 1 and part 2, that patient is highly chilly. Relation with heat and cold is chilly patient. So the patient will be prone to catch cold very easily. Complaints from cutting the hairs. Asthma. No bronchial secretions. The dyspnea is paroxysmals, and according to Dr. Harley, in asthma originating in peripheral or centric nervous irritation, the subcutaneous injection of atropia is followed by long continued relief. Nervous, spasmodic, dry cough at night, loose mornings, whooping cough. In some epidemics, atropia will cure the paroxysmal cough in 1 week. So this was all about the respiratory symptoms of the patient of Belladonna. Now next, we will discuss about Skin symptoms of patient of Belladonna. So there will be eruptions, smooth scarlet color with very pale face, red and swollen. Erysipelas with smooth, shining skin and not much swollen. Eruptions appear suddenly and vanish suddenly. Skin highly congested, dry, bright red and smooth surfaces, as found in case of boils, scarlatina, erysipelas and carbuncles. Sudden hot flushes followed by perspiration at the climacteric stage, inflammation that comes suddenly and leaves suddenly, and the same with neuralgia. Skin symptoms of patient of Belladonna. Now next we will discuss about the fever symptoms of patient of Belladonna. So first of all, causation means what is the cause behind. So draught of air, cold wind, uncovering the head from haircut and summer sun. So these are the basic etiologies, or you can say cause behind symptoms of fever. There is severe chill in the evening, mostly on arms, with heat of head. Along with natural chills, there is external burning heat. Chill and heat often alternates. Extremities are usually cold. There is high fever, sudden rise of temperature with red face, throbbing of carotid, pulse strong and quick. Intense burning heat both internally and externally. Sweat is only on the covered parts and head. Or there may be complete lack of any sweat. Sweat, if it occurs, appears and disappears suddenly. Generally, there is no thirst in fever. Pulse is frequent and full. Chill not relieved by heat or stove. Fever comes at 3 p.m. This was all about the fever symptoms of patient of Belladonna. Now next we will discuss about the brain symptoms of patient of Belladonna. So meningitis, what is the cause? Draught of air, cold wind, uncovering the head from haircut and summer sun. Mode of onset, sudden and violent. Symptoms during meningitis. There is stupefying, stunning headache from the neck to the head with the heat and pulsation. Heat is inclined to bend backward, boring the head into the pillow. There is a congestion and burning sensation in the head and brain. Spasmodic distortions of the face and the lips, grinding the teeth with inclination to bite. There may also be irritability and acuteness of the sense of taste, smell, touch, sight, and hearing. Of Belladonna, that is brain symptoms. Now next we will discuss about the general modalities, that is aggravation and amelioration. So aggravations, first of all, means what are the things from which the patient don't feel better, and what are the conditions which aggravate the condition of patient. So the aggravating factors here are from touch, motion, noise, draught of air, looking at the bright shining objects after 3 p.m., night, after midnight, while drinking, uncovering the head, summer sun, lying down, least jar, motion and strong smell. Now what are the ameliorations? Means what are the things by which the patient feel better. So amelioration here are rest, standing or sitting erect, and in warm room. So these are the general modalities. Now next, as you can see here on the screen, we have provided clinical aspect. Means what are the conditions or diseases which can be treated by using this medicine, that is Belladonna. So one by one we will talk about them. So first, asthma, then abscess, apoplexy, boils, meningitis, carbuncles, cough, deliriums, heart troubles, mumps, menstrual problems, skin affections, vertigo, whooping cough, abdominal affections. So all these symptoms and diseases mentioned here One can treat them permanently by using Belladonna. Potentized form of Belladonna, that is a home medicine, has the property to cure all these diseases mentioned here. So one can treat them successfully by using Belladonna. So this was all about the clinical aspect. So that's all for today. See you guys in our next video. Till then, stay connected with us and don't forget to subscribe and comment below. And thanks for watching our video.